A landmark agreement reached by the World Health Organization could change the way countries respond to pandemics. After 3 years, 13 rounds of deliberations and headbutting among 193 member countries, a legally binding treaty has been finalized without the United States.
This pandemic agreement is going to, one, to make the world safer. The second is that it's intended to ensure that the prevention and preparedness as well as response measures are in place in the event that you have another pandemic.
The race to tackle pandemics better was born out of the failings of COVID-19, which left health systems flatlining and poorer countries clinging onto survival without vaccines. Among the key elements are commitments to enhance technology, strengthen global resources and workforce capabilities, funding and knowledge sharing on diseases.
When outbreaks happen, we need to have characterized what the pathogen is that causes the outbreak, whether, the method of spread, the speed at which it spread, how rapid it is, and be able to then determine how best to come up with preventative measures or to come up with your response, or also public health measures that are necessary.
South African-based tech company Afrigen Biologics spearheaded a groundbreaking WHO-backed initiative to develop the mRNA vaccine at the height of the COVID-19. It's now taking up the fight against other diseases plaguing the continent and has the go-ahead to produce the Rift Valley fever vaccine. Such efforts could be strengthened by the pact.
To further build the capacity, the capabilities, to innovate and develop new vaccines, not Rift Valley fever, one of it, but others, is incredibly important for South Africa as South Africa fosters health security and as South Africa prioritizes this sector as a key contributor to health security for the continent.
Since the pandemic, African leaders and the Centers for Disease have been pushing for medicines to be produced locally to reduce dependency on imports.
The pharmaceuticals must be manufactured here and be bought here on the African continent, because we buy our pharmaceuticals in other continents, especially generics from India and originator drugs from the USA and Europe. So it's high time that Africa must think about standing on its own.
The fight started by the continent for equitable access to healthcare during COVID-19 may finally be paying off. It's only the second time in the WHO's history that an agreement of this magnitude has been reached, the first being the Tobacco Control Treaty 12 years ago. The new pandemic agreement is expected to be adopted at the World Health Assembly in May, setting the groundwork for the G20 health ministers meeting later this year. Julie Shara, CGTN, Johannesburg.